Hi, everyone. This is Ashley from Smith Physical Therapy, and I am at the Kenosha and Crystal Lake Clinic. And then we also have...
Hi, I'm Abby with Smith Physical Therapy and Running Academy as well, but I'm at our St. Charles Clinic. And we are going to talk today about kind of return postpartum to working out, all those kind of questions. Fun thing is, Ashley and I are both clinicians at Smith, but I just recently had a baby 8.5 weeks ago. And so it works out perfectly because I have some general questions that every woman who's postpartum has. And just even being from a PT, I still have a lot of questions that I don't know because I'm not a women's health specialist. So Ashley and I kind of thought this would be awesome to get out to people and kind of spark interest of normal questions that every woman has after they have a baby, and then what do they do about returning to working out, running, etc. So we are going to ask some questions that I have personally, and Ashley is so kind to answer them from her expertise in women's health. So is there anything else, Ash, that you wanted to fill people in before I start zooming away with questions?
No, I mean, I think the biggest thing is just to know that it's normal to have questions. I mean, I have two littles, and I've been doing pelvic floor for about 2 years. So after my first one, I'm a PT, but I also kind of was a little lost on like what's appropriate and what's not appropriate. And it is very much subjective. So it really depends on the person, but our goal here is to give some general guidance, and then to just let everyone know, like, we're here as a resource, but also, like if you're not in our area, to just kind of consult a pelvic floor therapist. It doesn't necessarily mean you need treatment. It just means, sometimes just a little bit of guidance to know that you're headed in the right direction. So yeah, but anyway, I'm ready. Fire away when you're ready.
So honestly, really, I was shocked because when I had the baby, I just thought like, okay, I'm going to bounce right back. Like 6 week, doctor's going to say, okay, go ahead, start working out. And I actually have had some like apprehension. Like I haven't started running because I'm scared a little bit. And being that I'm a PT, you would think like, okay, I know how to do this. I know how to get my pelvic floor going. But like, that's one of the things is I went back to my 6 week appointment and the doctor is like, hey, you are cleared, your uterus, everything has shrunk back to normal. So go ahead and start your training. And I asked her about women's health. And to be honest, she didn't know about women's health. She didn't really recommend it because I said, what do you think? Should I have a consultation? And she's like, well, that's interesting. I don't know much about women's health. Can you educate me? And so then that's when it kind of sparked my thought, like, well, okay, so she says I'm ready to go back to work or back to working out or running. I can do whatever, jumping, so on and so forth. But how do you really know that you're ready, even though your OB clears you?
So I think it's totally common for your OB at whether it's like 6 or 8 weeks, depending on vaginal or cesarean, to just, for the most part, to just say you're kind of good to go. And I mean, I definitely fell into that category with my first of like, great, I'm gonna start doing everything again. And there's a lot of layers to this. So I think it depends on what you've been, kind of what your activity level was at before baby was born, even before conceiving, kind of what your base was, and then what you've been adding in since baby was born. So really in that first like 3 week period, it's a lot about like rest and recovery, breathing exercises. You can start some light pelvic floor and transverse abdominis strengthening. So core strengthening, not sit-ups and crunches, which I think we're going to talk a little bit about later. But if you've been kind of setting that base up and then slowly ramping up your walking, then I feel like you're kind of in a good place to continue that slow progression up. So then you can go into some like mat-based exercises where you're on the ground doing some strengthening, maybe some standing body weight exercises. And then if all of that is going well, if you're having no, what I call pelvic floor dysfunction, meaning like pain, heaviness, incontinence, then you can go maybe into like box step ups, and then continue to slowly ramp up depending on what your end goal is, whether it's CrossFit or running. But ultimately it needs to be symptom free. And I really, as I've learned more within this world, I really say like 12 weeks is about when I would say to return to more of that running, jumping sort of exercise. Yeah.
Yeah, I mean, that's kind of how now that I'm like 2 weeks cleared, what I basically started doing was a lot of the end of my regimen when I was pregnant. So, I wasn't doing like a lot of supine stuff or laying on your back. I wasn't doing any crunches or plank work. So I started returning to a lot of like half kneeling or just like some trying to get like my core and my arms strong in like a staggered stance position and decrease loading. So I sort of went back to the very end and I'm starting to build that base there. So I don't know if that's recommended, but
and I think that's a really simple way of thinking of it, is like the reverse of what you ended with. And I think, I really like the quadruped position. So like hands and knees for like core activation or even just getting glutes engaged. And so, no, I think it's a simple way of thinking of it, like starting again at the end, basically, and working your way backwards. Yeah.
Perfect. So my brain was thinking correctly.
Yeah, you were.
And so kind of like to piggyback that question I asked when I asked my OB about going to see a women's health specialist, and she kind of didn't have a lot of education regarding whether you should or shouldn't. Do you recommend that all women have like a women's health evaluation or assessment, whether you're cesarean or vaginally? Is that sort of like what you think would be a good protocol, or should they wait until they have, incontinence issues, leakage issues, or pain? What's your recommendation?
I mean, and this is probably going to, like be me on a little soapbox real quick here, but, I think I think it's beneficial just to get it checked. So, like when you're getting checked by the OB at your 6 or 8 week mark, they check very differently than what we're looking for. So, I'm really looking to see like, what do the muscles feel like and what are they doing? And are you set up for success? So really we're looking at prevention. So my goal is, to sort of see a change a little bit in the way we operate, especially here in the US. I know like overseas things are a little different for women. But I really think if people were checked out ahead of time and then released back to a gradual return to full activity or even full return to work, depending on their job demands, we would see less of an issue later on in life. And so I always give the example, like whether you were C-section or cesarean or vaginal delivery, say you were vaginal and you had some tearing, I think there's this kind of societal pressure that like, oh, I'm super mom, I'm going to get back to just everything I want at 6 weeks. I can do it all. Or even like in some cases, their job requires them go back at 6 weeks. But if you think about it, if you have like a shoulder labral repair, you could have 16 plus weeks off of work, depending on the job you have. And you're getting physical therapy that whole time and you're getting recovery. And I know that's kind of an extreme example, but I mean, you've literally had a complete change of your whole body through that 9 months. You now have delivered a baby, your body is still changing, hormones are still circulating. And I think it's just unrealistic to think that people can return back to whatever they want at 6 to 8 weeks. And so I think from a prevention standpoint, I think everyone at 6 to 8 weeks should just right away go see pelvic floor PT. That's not quite where we're at as a society. So I would definitely say like, if there's even like one symptom, like whether it's just that achiness in your pelvic floor or some incontinence, even if it's just with, oh, I sneezed a couple times and just a little came out, right away reaching out to a pelvic floor therapist, just to make sure that, your pelvic floor is set up for success. So, yeah.
Well, and I think, it's interesting because, even as like a therapist, you think about surgery and I didn't have a cesarean, but, I did have some tearing and I had stitches, and it's like, that is a surgery. And I think about any type of surgery, we have some sort of rehab or exercises or specific stretches, and we are, sought out by an expert a lot of time. And so even with me, you and I had kind of talked prior, I wasn't sure, like, I know there's weakness and there's tightness usually after, you have an injury or you have surgery. And so, you don't always know that unless you're getting it assessed and from like a manual hands-on standpoint sometimes. So, I think that was when I reached out to you and I was like, should I, see a women's health? And you were kind of like, well, yeah, probably.
Yeah.
So,
and the goal isn't to push PT. I mean, it's just like our goal from a physical therapy standpoint is always conservative, and our goal is to not necessarily like have people coming 12 times or, we just don't operate like that as a company. But it's really about prevention. And I think, we operate as like, we want to set people up for success, and the pelvic floor shouldn't be thought of as anything but a sling of muscles. Like, this is literally just another muscle layer. It's not touched on or talked about because it's seen as just such a sensitive area. And I think really like it's hard because we have to start like as a society changing that. And I think there has been some positive change, but yeah, it's just really another muscle layer. So
right. And I think you kind of like talked about this, but
Mhm.
just kind of dive a little deeper in the plyometrics, the jumping stuff.
Sure.
You know, when do you know you have enough control? I mean, obviously, if you have seen a women's health specialist, they're going to kind of guide you of
Correct.
when they feel you have enough control. But let's say
Mhm.
they haven't seen one or there's no one in their area. Like, is it when you don't have leakage? Is it when you don't have control or pain or discomfort? You said kind of 12 weeks, but what would
Mhm.
be if someone's out there watching and they just want a baseline, what would you give them to kind of help guide?
So I think still kind of like rough guideline of, the first few weeks is just more, core transverse abdominis, not crunches, and breathing and some light pelvic floor, and then walking. And then as you progress, increasing that walking, nothing before the 6 to 8 week mark. And then even then it's still more the body weight. And if people are doing really well, like if someone comes in and, I have checked them and I do feel like, hey, we're in a pretty good position, then I will progress with like, okay, body, you've been doing body weight. Let's add more weight to that. Or, you were doing step ups, let's add weight to step up. And then I'll progress a little bit with like, okay, let's do some more single leg balance stuff. So let's get you on one leg. How's your stability? Am I noticing any sort of hip drop or anything that concerns me? Are you having any symptoms? And then we might progress to like little hops in place, or maybe some skipping, or maybe little baby box jumps if their goal is to get back in that CrossFit level, where they're doing more consistent box jumps and double unders. And then as that's all going fine, like I think form looks good and they're not having any reports of any adverse effects, then we just continue to ramp up there. So then we increase box size, we increase reps. Maybe instead of singles, they go to double unders. We make sure that goes well. I myself don't CrossFit, but I feel like I've treated quite a few within that world, and it's a lot of demand on your body. And so I think the biggest thing is just continuing that slow ramp up, making sure that you're touching base with the PT, if again as needed, and then also making sure that you're not noticing any adverse effects. Whether it's incontinence or whether it's just I have some heaviness when I'm done. I think the heaviness is often the thing that's overlooked because people think, well, I'm just sore because I haven't worked out in a while. But if you're noticing kind of like that achiness, or even sometimes I feel like it feels like there's pressure or bulging, or like the best example I give is like it feels like you have a tampon in, but you don't actually have a tampon in. Those are all what I would call like yellow or even kind of red flags of like, okay, I think that's probably a little bit too much pressure down on the pelvic floor.
Yeah,
so, and then
awesome.
I also look at breathing. I want to make sure people aren't holding their breath with activities, because then that is just pushing down even more as you're trying to slowly go back to like those plyometrics. So.
Awesome. So I'm going to grab little man because he's screaming. He's on a nap.
Oh, good.
How
Okay.
timely, right?
Yeah,
so
right.
We'll bring him into this conversation. So if there's anything you want to add really quick, but give me 1 second.
Do you want me to go to the next thing?
Yeah.
Okay. So I'll talk a little bit about one of the next questions that Abby was going to ask about was some stretching pre and postpartum. And, I don't want to just keep saying that this is subjective because I feel like it's always frustrating as a listener. But to a small degree it is. I think if you feel like prepartum, that you always were, tighten your glutes or tighten your hamstrings. Those are certainly areas to continue to work on postpartum. If someone's coming in and they do have pelvic floor tightness and tone, when I assess them, then I like to do things like prayer stretch, happy baby, kind of like anything that opens up the hips more, where they can just really focus on the inhale, exhale, and relaxing the pelvic floor down. And I think the number one area I see, especially with women, is tightness in their hip flexors and kind of quad area, mostly because that usually is compensating for underlying core weakness. And so a lot of what I do, hi buddy, a lot of what I do is just reassess like, okay, do we have some hip flexor tightness? I'll usually help release that. And then I give them some hip flexor stretching and quad stretching to do for home, in addition to actually doing the core strengthening to prevent the hip flexors from getting tight in the first place. So just so you know, I just answered the pre and post stretching question.
Okay, awesome. So and this is kind of like it, the next one is just sort of an add-on. It's more of that exercise base, but like, what kind of core strengthening exercises should you start with? I think you kind of talked about this. Should you do back exercises? Should you start with bridges? Kind of like what's your recommendation, and what should you avoid on those initial few weeks until things seem to be rolling?
So I have people avoid crunches and sit-ups until they don't have the diastasis, the doming, which we're gonna touch on that in the next question. I still prefer like you start supine or quadruped with transverse abdominis, and we actually on our Smith PT YouTube channel we have a video I did, just a quick video on like what the transverse abdominis is and how to isolate it. So everyone can kind of check out that too. But the transverse abdominis is basically what's going to help stabilize sort of the gapping with the diastasis, which we'll touch on. But really, I have them avoiding any of those exercises. If they're showing good transverse abdominis strengthening or activation, I should say, then I'll have them maybe do like a plank, and I'll monitor and make sure, okay, like how does everything look? Are you engaging that TA muscle? If there's good closure, then I have them slowly ramp up. And you can get back to sit-ups and crunches and everything you want to do, and V-ups and like everything. But I think, there are ones that are more front loading versus like the ab wheel rollouts. Like I feel like is one that sometimes people ask me about. That's a huge front loading one. So if you have some separation of the rectus, that's going to put even more pressure out that way. So I call them the boring exercises. Like it's really making sure you have the foundation of the TA. And then when you have that TA, you can engage it with the other core exercises. Then it's just that slow ramp up again. Hopefully that answers that.
Yeah, totally. So I guess then how do you assess the rectus separation? And, like if because I was doing mine, I checked mine the other day. And so I had like a 1 separation above the belly button and below the belly button. So like if someone had like a bigger, which I'm sure you can explain a little more what that is if people don't understand, but if people have a bigger separation, let's say 2 fingers, 3 fingers, does that decrease their recovery time? Or how does that change the recovery? And then, what does that mean as far as separation? Because a lot of people don't even know.
Yeah. So first of all, diastasis recti is that separation of the rectus muscle. The rectus muscle goes up and down. And then, as baby grows, so there was actually a study that showed that at the time of delivery, 100% of women had some degree of separation. Now, I've seen other studies that haven't shown that, but I think to a small degree, it makes sense. Like as baby grows, things have to kind of expand and move out of the way. And so, to check it, you can lay on your back. There's so many, and I don't normally say to Google, but there are some good YouTube ones that are just really easy to follow. You lay on your back, you're feeling slightly above your belly button, and you just kind of curl your neck and shoulders up, and you see if your fingers go down. And if so, like how many fingers, and that's just how you grade it. So like when I'm grading it, I'm grading above, at, and below the belly button. The most I've ever had with a patient is 4. I've known a PT that has had 6, which is pretty big. And ultimately, it doesn't necessarily change how I start with a patient. Sometimes it might slow the progression. So if someone's coming in with a 4, and I'm also sinking deep because I'm also looking at how far can I go down, then it might take a little bit longer to regain that core strength than someone that's starting with a 1 or 2. But it also depends on how much are they going to work on their exercises at home, and how fast are they going to try to return to activity before they should return to activity. So I don't know if it necessarily makes a difference in overall recovery, because it just will depend on how much a person's willing to commit to really working on like stabilizing that center part. But we need good stability there, because if there's a lack of stability in that midline, then I think that's, most people call it pooching out or doming. Like that's where people complain about like, well, I feel like I still have a belly, but I'm not pregnant anymore. And a lot of times it is because that underlying weakness. So they're not loving how they look, but from a functional standpoint, which is what I care about, is like if there's lack of midline stability, then eventually what's going to happen is you might have some low back pain, or there's going to be more pressure down on the pelvic floor. So now we have some pelvic floor dysfunction. And so it's all sort of connected to, making sure that someone, again, is set up for success with all the duties and activities that they want to be doing. So hopefully that answers that.
Yeah, for sure. So, I think everyone kind of knows who follow us that I'm a runner, and you are as well. And so we work with a lot of runners. And so I decided, even though that, and this is kind of that plyometric jumping thing that we talked about a little bit earlier, that I was going to start strength training first before I started running. I just didn't feel like I think I really needed to wake those muscles back up. And so one, you kind of talked about this, but do you recommend doing strength training, building the core, the foundation, like we've talked about, prior to running? And then when you do start running, should you, kind of do a walk run program, or how should you kind of tailor getting back into running or those higher level?
And I mean, this one I kind of learned from personal experience, because again, like after my first, I sort of just launched into it, and there's still pelvic floor stuff I work on myself. And I think part of it is because I started incorrectly. So I feel a little bit more passionately about this return to run question, because I feel like I wish I had done things different in 2020. But I think with all of our runners, the biggest thing always lacking is strength training. Like, I feel like 9 out of 10 injuries we see, some of it's technique, but then a large portion of it is just overall weakness. And so I love the idea of starting a strength program, because really you can start strengthening again, like at that 3-week mark, even though it's the boring exercises, it's the TA, it's the pelvic floor, it's the breathing. Those boring exercises are the foundation. And then it's just building off of that. So even though you can't run, I like to say, 10 to 12 weeks, more 12 weeks, even though you can't run until that 3-month mark, you can be doing a ton to set the stage for such success with the return to running. Like, you can start running pretty, like in a pretty good position, and which is only going to help injury prevention. And then when starting to run, I really like a walk to run program. Mostly because I feel like it gives you time to monitor, because especially for a runner, you're going to start running and you're going to be obviously not to the level you were before, but you're going to want to keep running, because, like, oh, 2 miles, why am I just doing 2 miles? But I think by walking, running, you can actually see how your body's responding. So I have a good example. I have someone that's not recently postpartum, but later in life. And so she only has incontinence when she stops running. Well, how would she know that if she just went out and ran, 5 miles without running? Like, those are kind of those yellow flags that we're looking for. And so I think when you start running again postpartum, it's great to start walk to run, because you can really monitor. So if you go out, you walk, a quarter of a mile, run a quarter of a mile. How do I feel? Oh, I feel pretty good. Like, okay, well then maybe you repeat that a few times, and like, how do I feel? Great. Okay, that's good for day one. And then slowly ramping up from there. And I just feel like it's a better way to monitor yourself, because it's, like, you can check in on your symptoms then.
Right. And so then I guess, like, is there a time when, let's say someone followed all this protocol and they started at 12 weeks, they did a walk to run, would you recommend them ever stopping running if they start having increased pain or urgency or incontinence, or, obviously, would that be a good time for them to see someone? So kind of what would be your guidelines for stopping if things are kind of getting out of hand?
Yeah. And I think this was like always the answer in PT school that drove me crazy. It depends. But, my goal is it depends on how far postpartum, because once you're postpartum, you're always postpartum, right? But if we're talking initially postpartum, like as in you've just started running, you're already having some symptoms, I would stop running right away, and just touch base with a PT. And at least, like, sometimes I can just talk with someone and say, like, it really sounds more like a strength issue rather than a tone issue, because you treat them different ways. And so I might give someone like a couple things to start trying, and it doesn't necessarily mean they need to become a patient. Now, other times it's like, if we talk, I might say, like, I really think you really do need to get checked out. And then we might modify. Now, if I have someone coming in that's a little bit more postpartum and 1+ years, we'll say, and they've been running since the 6-month mark again, and now all of a sudden they're having some, like, complaints, I would probably initially want them to stop. But I think as runners and also PTs, we also appreciate the emotional and mental benefits of running. So I don't ever want to take that away from someone, especially if they have returned to it and had been doing well with it. So then I would be trying to, continue to keep them running, but symptom free. So we'd be looking at running form, technique, what else has changed in your life that could be contributing to these symptoms suddenly arising, and with the goal of also keeping them running throughout this. So hopefully that's not confusing, but yeah.
No, not at all. And I think we kind of already answered this next one where we're talking about like what are some pre-running. But I think my question was more like, what would you do, initially postpartum, which since that's the stage I'm at, or you can answer this to, 1 to 2 year, but are there certain exercises that you would do like when you are already at that return to run phase, like as a warm up, like I want to get my pelvic floor going, or I want to warm up, we kind of go through warm up drills with all of our runners. Would you just kind of stick to some of those general ones, or is there, like, would you do happy baby before or after you run, something like that, that would be more specific to a postpartum gal?
Yeah. And I think if we're talking postpartum and they've been, symptom free and they've progressed and everything's been great, and if you're talking about just like they're just kind of starting out, but they're a little concerned or hesitant, even though they've been doing great. I think just doing some Kegels beforehand, almost like as a primer, like just kind of whether it's, I say sometimes a Kegel with sit to stand. So I'll have people sitting in a chair, and as they're coming to a stand position, I have them exhale and think about tightening and lifting that pelvic floor up like it's an elevator, almost just to engage. And I think, I feel like that's just a good way of like, if you're thinking about kind of like warming it up, like, hey, let's make sure you're on during a functional task. Or even if you squat down to the ground, as you come back up, exhale and think about lifting that pelvic floor up. Or if you're doing some, jumping in place or some skipping, you can kind of visualize that sling of muscles, that pelvic floor. And as you're doing those exercises, and we use skipping and backwards running and some karaoke and some of those as actual running technique drills too. But you can think of those as like, 1, a good warm up, and 2, a good way to really connect, like I say, mind with body. So like connecting with your pelvic floor and connecting with your core and making sure that they're both awake for the day, before you go out and do, your run.
Yeah. Awesome.
Yeah.
So I think we've kind of answered this next one sort of, about when to see women's health, and I think we've talked about, it's probably case by case base, but, it would be wise, and definitely if you're, kind of unsure of the guidance or if you're running and stuff like that. Is there anything lastly you would recommend or talk about, I guess, if people are still unsure what is women's health, or what would maybe an evaluation look like? And because some people are just like, I'm not even sure what that is. And if I did think I needed that, what would be the steps to seeing someone?
Yeah. So I think, if you're having symptoms, I think you can look that up, like the APTA. You can even just Google like pelvic floor therapists in the town you live in. Like usually something will pop up. Or you can try to ask your OB-GYN, but 9 out of 10 times they will not know an answer. And then a pelvic floor, typically sessions are for us at least are an hour. And so I feel like it's a lot of talking, because obviously I need to know all about the history, what is your postpartum experience? And then I check everything externally. So I'm looking at like, how are you moving in your mid and low back? How's your flexibility? What is your core strength? Is there diastasis? Do you have certain abdominal muscles that are dominating over other abdominal muscles? What are our glutes doing? Are they firing? And then pending the patient, so whether I think there's a need, which a lot of time I do, and whether they're open to it, I do an internal assessment. So I first check everything externally, and then it's not like an OB-GYN visit. So there's no stirrups or speculum. But basically I'm checking the different layers of muscle, and I'm seeing if I'm noticing any tone or whether you have tenderness. And then I'm having you activate the pelvic floor, and I'm seeing how your fast and slow twitch muscle fibers are working. And then whether or not you have any sort of vaginal wall descent, which is called prolapse, which I think always freaks people out when I say it. So I don't say it that often, but whether we have any sort of like descent, meaning there's just a lack of stability in the pelvic floor. So those are the main things I'm looking at. And then we start some treatment right away, and you get homework to go home with. And we talk about activity modifications based on your goals. And that's usually day 1. So. Does that answer all your, okay.
Yeah. And I think, this just sparked my mind just from being a therapist, but, sometimes people think they need to have pelvic floor pain to actually have a pelvic floor weakness. But I mean, I know that I often see, some women have back pain or SI pain or hip pain. And a lot of times when we start rooting around, sometimes we find it was stemmed after like delivery or birth. So, even letting people know that, you're not just assessing the pelvic floor, but sometimes it is a part of a contributor to some pain when people have back pain and stuff like that. So
yeah. And I think a big one I see too is like high hamstring pain. So like those chronic hamstring injuries that just don't want to get better. Usually there's some sort of pelvic floor dysfunction going on that's sort of driving that chronic problem. So I would say, yeah, that's what I mean by postpartum. We're talking more like postpartum initially, but you're always postpartum. So I mean, if something comes up and it's just like this ongoing issue and you're like, gosh, well, I mean, why would I have a pelvic floor issue? I had my child 10 years ago. It's like, well, I mean, yes, but we don't know what's been going on with your pelvic floor for 10 years. And sometimes that it's an excellent point. Like sometimes it doesn't manifest as what you would think it would, which is the typical like peeing your pants or those type of things. Sometimes it does manifest elsewhere. So yeah.
And then lastly, a couple, questions I had was just more general. So regarding like lifting and your recommendations, like when you have this little squirmer like this, even me, I notice like I tend to want to like hinge back.
Yep.
Is there anything you would avoid or kind of like, what are just some recommendations for bending, lifting with little ones and, kind of when you're nursing, holding? Do you have any recommendations?
Yeah. So I think let's talk about the bending, kind of holding, and then we'll go into nursing because I think that bridges into another question we have too. But some of it's going to be overall like what you're allowed to do. So, like if you had a cesarean versus vaginal birth, like sometimes doctors put lifting restrictions on you based on how things went. So I want to preface that first, like, but if everything was fine and it was good healing and everything, then I think the biggest thing is just protection of yourself and your back and your body. So, typically at this age, they might not be in the crib yet, or, when it's a newbie, but you're still bending over a lot. And so I think, for the most part, when you're in those initial stages, really relying on, family, friends, your partner, to really do some of the heavy stuff, like carrying the carrier, and those type of things. But we live in the world we live in. So if we're being rational, I think it's just when you're lifting the carrier in and out of the car, keeping the carrier close to your body, always exhaling with exertion. So if you're taking the baby to the pediatrician for their, 2-week check, as you're lifting the carrier up off the ground, exhaling as you're lifting and trying to think about some very light core and pelvic floor engagement. And then just in general, like I think awareness. So I always use the term stack your stuff. So rib cage over pelvis. It's very natural, especially as baby grows, to want to pop your hip to the side and rest baby on your hip, especially so you can use your dominant arm. So normally if you're right-handed, you kind of pop your left hip, try to put baby on the left hip. So I would just say try to avoid those things. Think of it as your core workout. So if you're keeping kind of that neutral posture with rib cage over pelvis, you're going to have to keep your core engaged. And so that way you're just protecting like your low back and making sure that everything is in the position it should be. And then nursing is like this whole, we could talk for a while about proper position for that. And I think ultimately, like I love lactation consultants and I defer to them for a lot of things like that, especially if someone's struggling with nursing. But I think ultimately, like it's getting yourself a good setup so that you aren't, I know I caught myself once with my second, I was in this kind of weird, like, I wanted to make sure she was, excuse me, latched. And then I just was like, oh, she's so cute. And all of a sudden I caught myself with my head at this like super, super weird angle. And I know better. And so it's so natural to want to look at your baby. But I would say, once you're in that setup, baby's latched, it's okay to glance down, but I mean, I wouldn't be like looking like this the whole time. Because again, you're going to start noticing a ton of tension in your upper back. Your neck's going to be sore. And the last thing you need to worry about as a new mom is all these other things going on. And so I think just awareness, or even educating your partner on these things so they can kind of call you out like, hey, you're kind of doing that weird neck thing again. or didn't the PT say to stack your stuff, just so someone else can be watching you, because you have enough going on in your brain that this shouldn't be another thing to worry about. But we're just trying to prevent other things from occurring.
I know the lactation always told me, bring the baby to you, don't come
Correct.
to the baby.
Yeah.
Because then you end up kind of hunching forward. And one thing I remember the first couple times when I would nurse in bed, I would try to get up out of bed with the baby on to put back in the bassinet. And so I would be crunching, and I realized like I could feel the separation, because this would be like week 1 or 2, and I'm trying to get out of bed holding or get into bed holding the baby. And I don't have this core strength. And so I kind of stopped doing the in-bed nursing as much as it seemed convenient. Sure. I just felt like I just can't manipulate him and have my core, because it's you can't sit up and get a baby off the bed without, trying to use your core. So I know that was like right away. I was like, all right, enough of that. That was one big one for me.
And I think too with that, like if you want to be in bed nursing, like if it's the middle of the night, you're tired, like you can always prop yourself up on pillows, so you're still kind of more comfortable. You're not having to go very far, but then all you have to do is swivel your legs to get out of bed, rather than, like you said, and that's a great point, I forgot to bring that up, like that kind of crunching like motion, because even if you don't have the baby in bed, I would still be rolling over onto your side and then pushing off, just to protect that midline, especially if you've had especially if someone has had a cesarean. So yeah.
Sure. And then I guess the last one, it's still kind of nursing. I think that's the last one, but as a therapist, we kind of know, and I think a lot of women know, that you start to produce a lot of hormones when you're pregnant and post-pregnant, especially if you continue nursing. One of them is that prolaxin that, kind of relaxes the ligaments and allows the pelvis to grow so you can push that baby out or whatnot. So does that have any, because I had a girlfriend one time tell me that her OB said, don't even do women's health therapy until you're done nursing. And I was kind of taken back, because she said, you have that hormone, that prolaxin hormone, so you're not going to get any benefit anyway, because until that's done and you're done nursing, you have that hormone and it's going to cause laxity. So what's kind of your take on that when it comes to recovery and strengthening and all that?
Yeah, I was trying to find some good research on that specific part of the question, and I didn't find anything like I loved. But I think ultimately, like, hormones are going to continue. We could flip it around and say certain things about menopause then too, that you don't want to be doing certain things because, again, estrogen dips, and estrogen helps with stability. And I think it's more about awareness of your body, which is kind of this underlying theme, right, that we've been talking about this whole time, of really kind of tapping into like what you're noticing with your body. And, I don't think that there's been some good research to show that like exercise has helped actually with milk production. There was one study that showed that. But I think overall, I think it's just kind of the awareness that, like, yes, those hormones will continue to circulate. But again, a baby's needs and demands are going to change from when they're newborn to when they're, 6 weeks to 6 months to 12 months, depending on your breastfeeding journey. And so I think I encourage, strengthening and ramping up to the activity level, because I also think, again, we have to look at mental health and emotional health and well-being. And those also are important aspects. And if someone has those goals of running or, trying to do a sprint try before the baby's 1, like, I will help them along that way. And I think it's just, again, the awareness of like, how is my body responding to that? I think another question I get is like, well, I've heard that a lot of exercise will dip my milk supply. And there's been no research that has shown that. At least that I saw. And if anything, like, it might, depending on the level or how strenuous an exercise is, it might affect like lactic acid. But there was no research to show that it decreases a person's milk supply. I think you need to have awareness of making sure that you're hydrating to the level of activity that you're doing, that you're replacing those calories appropriately, which are things that are just important when nursing in general. And I think lactation consultants do a good job of educating on that. And so, I personally support exercising and strengthening and monitoring how your body is responding to that, regardless of where you're at on your nursing journey. Hopefully that answers that one.
Yeah. No, I totally agree. I just, sometimes asking the expert is the best scenario. And I think that's kind of like my takeaway. And for all the women listening to this is, I am a physical therapist and I do not treat women's health. I'm not an expert. And so, when you do have questions regarding, always seek recommendation and, try not to muster through it on your own, or even sometimes Google and Instagram it can be great. And it can also be a hindrance because, you're different. I'm different. My recovery, my journey is different. My birthing scenario was different, So I think sometimes if you have questions, reach out to people who can help you. And like you said, like we have injury screens that I'm sure a lot of places do too, or if you have questions, I'm still going to have questions, I'm sure, along this journey being only 9 weeks. And just kind of dipping into some of that, beyond the TA contractions and Kegels. I'm starting to strength train now. And so I'm feeling different things. And I definitely think I'm going to get an evaluation because I want my long-term journey to be a success, not just postpartum, the first year, and like you said, we're postpartum forever. So,
and I think too,
that's like
just to add on to, just to make a point on what you said too, like I see a lot of women, I would say a big chunk of like the women I treat actually are more like in that perimenopause, or not even perimenopause yet, but like a little bit, we'll say later in life. And now they're starting to have some dysfunction. And so sometimes I think to myself, oh goodness, if only I had gotten to you, initially instead of later on, because yes, your body will continue to change. We can't stop perimenopause and menopause, and hormone dips will possibly lead to some dysfunction, but they don't have to. And again, I think it's just about, setting the body up for success long term. And I think the best time to do that is more initially postpartum. Yeah.
Well, great. So that's all I got. Little guy here, thanks you, and I'm excited to get into this journey.
Yeah, and I think Abby and I, just in general too, like even if you're not in this area of where we treat, we are always open to questions. I once helped a runner in like Minnesota because she read an article I wrote for a blog. So, like we're always happy to help you find a good fit. So if you have follow-up questions, you can feel free to reach out to us at Smith PT, and we will facilitate as best as we can.
Yeah, and if you're watching this, I'm sure we're going to kind of have other resources on our page, and we'll link some stuff with this video too to help navigate, but always reach out to either of us with questions regarding women's health or PT. So
awesome. All right, thanks, Abby.
All right,
bye.